Hi, everybody. My name is Dorothy, and it's a pleasure to meet you all. I wanted to sit down and have a conversation with everybody about hospital revenue cycle, why it's important to those of us that are at the bedside, and why it is that we really need to use it to our benefit to give our patients more supplies, more equipment, more advanced treatments, medications, all those elements that help us take care of patients in the acute care setting. So this is very critical, and I hope that you enjoy being a part of this conversation as much as I do. This is going to be part of a series. Um, in this presentation, we're just going to go over the general why it's important, and then in the next couple of um, YouTube presentations, I'll be explaining some common terms, verbiage, concepts about revenue cycle and how providers and coders and finance all work together to really take what we're supposed to, which is care of the patients that come through the front door of our hospitals and sometimes the back doors, but how it all works together. So we're part of a collaborative team that really is here to serve the patients. Hi. So we're just going to go over the disclaimer statement that is common for all presentations. Every effort has been made and taken by the author of this presentation, me, to ensure that the information is shared as current as possible at the time that it was developed and presented. The primary intent of this presentation is to be informational only and to share this information in a manner that is more relatable and understandable to those in the healthcare and various backgrounds and levels of experience. The information that is shared is only intended to be informational and is not to take precedence over any state, local, federal guidelines and/or organizational policies or procedures. Many of us may ask, why is hospital revenue cycle so important? Well, the basic, if there's no money, there's no mission. And the essence of that is there's no mission to take care of the patients in a place if there's no place to take care of them at. So if there's no hospital to provide the services to those in need of health care, that can no longer be managed in the community setting, and we need a hospital to take them to. So therefore, if there's no money to keep the hospital open, there's no mission. So if we want a place to take care of our patients that are too sick to be managed at home in the community that they live in, then we all must work together as a collaborative team to keep the hospital doors open. It's visible all around us, the hospitals, and especially in the rural communities where they're much needed, that there is no place to take care of patients. They're closing down one by one. There's a lot of articles and a lot of different, revenue cycle magazines, even casual, layman's magazines that really speak to the the crisis with keeping hospitals open, especially in the rural communities. So as I was strolling through one of these many articles, there's one that I really found from the U.S. News and World Report in 2023, and it's very telling, um, the story and the way that this is written. There have been close to 200 rural hospitals that have closed since 2005. And what's really critical about that is that these are the communities that already have delayed access to healthcare for many of the individuals that live there. It adds to the lack of timely and appropriate healthcare access that already exists for these vulnerable populations that already are having delayed access to healthcare for various reasons: finances, transportation. They can't they can't leave work to travel for an hour to get to a hospital. Also, by some situations, if it's an acute MI, they can't get there. It's going to be an ambulance transfer. So all these delays really are, are are already adding to the world of hurt that exists. Um, the aid that was given to help those hospitals that had increased costs during the pandemic, those are it. Those are done. Um, the increased costs were related to many things out of the control of the hospital. To manage to manage the patients, take care of patients, we needed extra protective gear, gloves, gowns, masks, shoe covers, all that stuff that we were taking inventory of daily, um, 7 days a week, 365 days of the year. Inventory was being managed. Staffing shortages for all all personnel in the hospital, doctors, nurses, respiratory therapists, and those in non-direct caregiving roles. Um, Also, a significant hit in the community that was trying to manage all these patients in the outpatient setting. So all of these components really together add to the critical shortage of dollars to manage to manage revenue cycle in the hospital and keep the doors open. So I have this slide here really to represent, you know, all of the elements that we need when we're managing a diabetic patient in terms of equipment and resources and team members are really important to lead to best outcomes for that patient, right? Well, also to manage a hospital revenue cycle team, have a healthy functioning hospital revenue cycle team. There's a lot of people that are needed for that too. So in terms of hospital revenue cycle, we need our finance department, our revenue integrity analyst to make sure that we are appropriately and compliantly um, adhering codes to have proper reimbursement that are adhering to the guidelines by the Office of Inspector General. We have coders that are trained to abstract from the medical record all diagnoses and procedures that a patient comes in with that they're being treated for or worked up for. We have the hospitalist, which is most of the times the attending provider. That is the basis for all coding documentation, consulting providers. So if there's a disconnect between, let's say, the consulting provider finds sepsis due to pneumonia and the hospitalist just documents pneumonia, you're going to get a clarifying query from the coder because it's the hospitalist documentation, the attending doctor's documentation. That is the basis for coding. And then we have a denials team that works on when we submit a bill to a payer, such as like Blue Cross or any Blue Cross or Blue Anthem or Medicare or Medi-Cal, we get rejected on payment. We have a team here at the hospital that works on getting those claims worked up to get reimbursed appropriately. So all payers, at one time or another, for whatever variety of reasons, will deny claims, and so denials teams work on that. And when we want to manage a diabetic patient and have the best outcomes, we need a primary care provider in the outpatient world. We need nurse, a hospitalist on the inpatient world. We need dietitians. We need equipment. So all this is critical. This slide will illustrate when we do not have a healthy hospital revenue cycle, we have decreased services and level of care provided, leaving some hospitals with bare and minimal services or closure. And then for a diabetic patient that's not well managed, there's vascular complications that result in blindness, dialysis, MIs. So I'd just like to take an opportunity to share with you some of the references that I used. The World Health organization has a lot of great material. I found these articles to be a great resource, and hopefully you'll find them too as a great resource to really understand and look at hospitals and revenue cycle and why it's important. So again, I would just like to thank you for taking the opportunity to sit down for us to have a conversation and discussion about hospital revenue cycle and why it's important to us that love serving the patients in our communities. My goal is to provide and share and encourage the exchange of information across the many silos that have existed in my last 40 years in nursing and hopefully many more to come. Because my belief is that we all are one team that share the common goal of providing care to all patients in need. So again, thank you very much, and you have a wonderful day. And in the future recordings, there will be explanation of the common terms and ideas and concepts used in revenue cycle, and then later on tying those into specific documentation opportunities that we have, like for diabetes, heart disease, all those others. So thank you very much and have a great day. Bye bye.